Hi, everyone. It's Alex Savage at KTVU, Fox 2 News in the San Francisco Bay Area. We're going to be talking about some of the latest news having to do with the coronavirus outbreak with Dr. Vanila Singh, clinical professor at the Stanford School of Medicine and former chief medical officer at the Department of Health and Human Services. Dr. Singh, always good to have you on.
Great to be back, Alex. Thank you.
So let's talk about the big issue here of reopening and this whole process that we're seeing play out across the country. I'm gonna start here in California where we are because we on Friday, just a couple of days ago, we saw the governor shift the reopening plan into phase two. So some retail, some manufacturing gets back up and running with safety protocols in place. But at the same time, there are still a lot of counties, including many here in the Bay Area, who are keeping shelter in place orders going for the time being. On the surface, it seems a bit confusing. How is someone supposed to sort out, exactly what's going on and how things are reopening?
Yeah, absolutely. So when you hear one federal guidance, and then that's given to the states to then further act on it, and then our state, Governor Newsom, gives that guidance to ease into phase two, start the reopening on Friday. But then you have variations of that opening based on what the county officials are saying. That can cause great frustration because sometimes it's not very clear to people what the reasoning is behind it. And we know that the Bay Area counties, like you mentioned, Alameda County or Santa Clara County and San Francisco and all, have chosen to take a more conservative approach, likely taking into their own public health officials and what they're saying. But from the economic perspective, the manufacturing perspective and other businesses, it is frustrating because they see a very real concern about how are they going to sustain their business. It's great loss, of course, for the workers and employees, even though they are sustained right now, perhaps by other additional help. What does the future hold? That's a challenge, and the different counties have had a different approach, and so this definitely makes it confusing. And I think now more than ever, we need really clear messaging about why, but also what the expectations are, that it's not a moving target in terms of what our milestones are that we're trying to achieve before we have more reopening. And I think that that will help the business community and certainly help the folks out there.
How much of this, though, is really going to be just a localized approach? If you have a certain county that still has a lot of cases, coronavirus cases are not decreasing the way they would like to see. And then maybe you have other counties over here that have very few cases and really feel like they can move forward with reopening with restrictions in place. Is this just going to be a localized approach here moving forward? There's not a one size fits all sort of method to reopening?
Well, absolutely. Yeah. And I think the, reasoning behind that is really based on our federalist approach, which is ultimately the best decisions are made at the local level because they're more aware of what the cases are, what the challenges might be. But having said that, as folks reopen in other parts of the country, there's more data and more understanding. So we shouldn't be so far out in terms of our criteria that hopefully it showcases when, say, a county in another state opens up and they're able to do it successfully. What was their method? What was the template? And can that be applied here? We know that the really mostly rural counties in California are itching to really get started. I think there were like 21 counties that have not had any deaths and in the last 2 weeks, and really want to move forward their businesses, the people who are really like hurting in terms of their daily paychecks. We know the famous case in Dallas was of that lady who was running the hair salon, and she really stepped forward in terms of her concerns. I'm certain that those are concerns held by people here. It has to be balanced against what the public health concerns are, but there is no one size that fits all in this
Right.
in this reopening phase of the nation. But on the other hand, there's a lot. The criteria should not be that far off.
What are the risks in terms of reopening too quickly?
Well, the concern, of course, is that we could suddenly hear about people developing new viral cases. And I would just say that we should expect that people will have the viral cases, that we know that if the virus is still around and it's present. The real thing is that if there's an outbreak, and what do we define as an outbreak? Sometimes people define it as just a few people. We know that those can happen in really close encounters, but if and when it does, to immediately address it, get the contact tracing out, notify people so they can self-quarantine and take those precautions. And I think a rapid response system really gives us a reassurance, plus the protocols of disinfecting, cleaning, the ability to have and maintain social distance is going to be really key. And I think that is what gives the reassurance. It would be surprising if businesses are not motivated to actually have that at this stage with all that we know, both from a motivation to where their customers want to come and seek their business, and also for them to not have to go through a shutdown again, which they are already hurting from, and know that that is something that they want to avoid. So the big concern would be that they could have new cases and an outbreak. But I think the key is that you have the reassurance to the public and also have the ability to rapidly address things
Right.
in coordination with the public health officials.
And do you think that the systems to do testing and contact tracing, are they at a point where if you started to see an outbreak here, once businesses begin to reopen, that we would be able to respond quickly?
Well, we're definitely much further ahead than we were a month or two ago in terms of ramping up testing. We know that there's so many different types of tests. I think having the rapid tests that are reliable, right? There's always concerns about what is the validity or reliability of the test, how specific and sensitive is it? We don't want false negatives, and so that's key. And I think we're better every day because there's so many more uh, labs, private endeavor efforts in coordination with the FDA that are moving in that direction. But the other thing is definitely the contact tracing.
Right.
There's mobile apps. The technology is already there, and to utilize it and ensure that we have a platform where that is being utilized and that it's easy to understand and use. I think that's going to be very key in terms of, again, identifying the outbreaks.
All right. What about as people begin to venture out more? What do people need to keep in mind? It's not just that, okay, some businesses have reopened here, so therefore I don't have to do anything as an individual to try to protect the public health of everyone else out there. There are still really important safety measures that people need to do, and you still need to be wearing a mask, right? If you're going to go inside one of these businesses.
Absolutely. Our own individual responsibility cannot be overstated in the sense that, look, we're all in this together. We want our businesses to be able to be successful, and that will come from their work, our work, and of course, the help and support of our public officials, our state government, our federal government, of course, the local governments, to try to ensure that they are successful. So not just to take this from a punitive perspective, but rather a supportive perspective. And I think individuals should feel that way too. And I would add, though, that we should definitely maintain a kindness and empathy that's there, rather than trying to, kind of get a gotcha moment with people, but rather gently remind or help and ensure that people have resources, because it's a trying time and not everybody understands each other's concerns. Everyone's situation, whether it's personal health or financial, differs. And not to be judgmental of people. They all have their concerns and obligations.
Sure.
I think that's really a key for this to be successful.
But at the end, I mean, there was obviously, you saw some of these situations where people don't want to go and wear a mask going into Costco, and but as a business, I mean, Costco is saying, look, this is our rule, and if you want to come into our establishment, you have to have a mask on per the local guidelines. I mean,
Absolutely.
it's important for each individual to adhere to that.
Right, absolutely. And look, they're private business. They are motivated to continue to be able to serve the public. Really, they've obviously, amongst other businesses, have stepped up, have kept open, have tried to provide food and other products that are important, and give everyone a sense of reassurance, because that panic would happen very quickly if we felt like our food products or other products weren't available.
Sure.
So they stepped up, and I think other businesses really want to ensure that their customers have confidence, and so they are going to enforce these. And I do understand it's hard. It's very hard for a lot of people to wear a mask all the time, right? Some people feel a sense of difficulty breathing or claustrophobia, or may actually have other
Mm.
conditions. So it's understandable. However, to see this as a means to, hey, let's ensure we're able to successfully do these early stages of reopening, because that's what's going to get us quicker back to where we were, which is, a free-flowing society, and everybody wants that.
All right. And lastly, here on the issue of reopening, what do you think about the idea of colleges and universities uh, having students back on campus? What is this? Is this going to happen, you think, or are things going to mostly remain online for the fall semester?
Well, it's hard to say. Colleges and universities are so variable in their size, their location, but they're all definitely under a huge economic pressure right now. And think about the disruption to student life and the mission of research and learning and innovation. Very disruptive. And I always say that if we don't put forth, or at least start to think about solutions to reopen in the fall, or even if it's just in theory, or in fact can be in practicality, we've got to start thinking about it now. And I'm certain a lot of folks have. The question is, how do you do it? And you really have to have certain criteria that are present, which is the same ability to comprehensively test,
Mm.
contract tasting. Very important. Universities generally, the student population tends to be younger, perhaps less likely to exhibit
Sure.
severe symptoms or be at risk, as we know, of people who are older or have medical conditions.
Well,
So to take that into account, but at an individual level, know that the students, will have responsibility, will have to adhere to social distancing as decided by the university
mhm.
in their dormitories or dining halls, if they're able to do it, and
Yeah.
maybe hybrid,
I
hybrid
mean,
sit.
yeah. What are we talking about? I mean, I'm just imagining crowded lecture halls. I'm imagining crowded dorm rooms where people are, students are living on top of one and right close to one another. In these dormitories. That seems like you have to reimagine a lot of that, right?
Absolutely. So we will absolutely have to do that. In fact, those are the things that it's good to imagine that and say, okay, how do we ensure that doesn't happen? So having the strict rules, figuring out, out of the box thinking solutions about maybe perhaps some percentage of the population of students can come back
Mhm.
while we ensure vulnerable folks are protected, faculty, staff, and maybe some of the students who may have some higher risk, and to come up with that plus distance learning, giving the other students an option, ensuring that if people travel to hotspots or come in, there's a self quarantine for international travel, etc. There are a lot of different ways to approach it, but to think about it now is really important, and it's well worth the endeavor, because even whether it's the fall or winter, we're going to have challenges both with the flu season itself, but also knowing that perhaps it could be seasonal and there could be another outbreak. But how do we prepare for that, and to limit issues while also preserving the whole purpose of it, which is really to have the student life back and have the learning and innovation to the degree possible that we can in a safe manner. And I think if we don't think about it and just start discussing it, it's just that much longer that it takes to get back into it. And some of the really upsides of the mission of the universities and colleges, and that life can be lost, and we
You
may
miss
lose
out on
more
a lot of
time.
that. Yeah. All right, let's shift gears. From the notion of reopening and what that's going to look like in the weeks and the months ahead, to kind of what this virus looks like, and it really does feel like every day our perception of coronavirus is changing. Initially, we sort of all thought of this as a respiratory disease, right, that was attacking the lungs, but now we understand that this virus is attacking all sorts of different organs in the body, whether it's the brain, the heart, the kidneys. Just how unpredictable is the coronavirus?
Well, look, just to take a step back, this virus was probably not even around in the human race just a few months ago. And, you know, when it actually came in is obviously stuff that is being investigated, but we are learning about this virus in a record amount of time. In a matter of weeks and months, we have really started to identify the characteristics of the virus. But as new things come up, we're going to investigate it, put some theories out there, retract, discard, or implement what we believe to be, you know, important. And yes, it is mostly a respiratory virus with people presenting with, you know, shortness of breath, fever, or other issues. But we do know that it also has two aspects to it that are really key. One is the inflammation, the inflammatory response that can be much greater than is needed, which has affected the lungs and people's ability to have the normal lung function that can even buy them time on a ventilator, or worse, have you know, bad mortality outcomes. The second characteristic is that we also learned that it can cause clotting problems in the body, lending itself to blood clots, and those blood clots can go to the lung and other areas and cause significant issues. It can also affect the heart, the brain. Some of the neurologic things that we've seen is the loss of taste and smell. Well,
Mhm.
that's it affecting the nerves. It can affect the kidneys. We've heard about cases of people who required dialysis. And really, even if you look at influenza A, they had the same respiratory symptoms. Some of those patients can have, on occasion, nausea, vomiting, and other GI symptoms.
Mhm.
But even influenza A can cause this inflammatory response with a sepsis-like picture, with people being affected with their heart getting inflamed in other
Right.
parts of the body. So viruses do act unusual, and we're learning what is the spectrum when enough people are getting affected, and the doctors are seeing and witnessing these different presentations. They're able to derive what the virus is actually doing. How is it affecting the body? It's still primarily respiratory symptoms, but we do know and have seen all these other aspects to it, and how it might eventually lead to mortality, which is including heart issues, and again, the kidneys being affected, and even the COVID toes, which, you know, is
Right.
really kind of this bluish presentation on the toes or the feet, which again can be actually related to the mechanism. And that's not actually how the vast majority of people present, but it is a characteristic of how the virus is presenting in people.
So, as we see the virus presenting in these different ways and attacking different organs in the body, is the virus changing at all as it spreads, and therefore, you know, presenting in different ways? Or are we just, is our understanding of what coronavirus looks like, what COVID looks like in a patient, changing?
I think it's definitely an yeah, absolutely. I think it is an understanding when you have enough cases that are there, and we're better informed, better educated, we being the scientific community, physicians, frontline folks, and of course, the larger society as a whole, we're learning. As far as genetic mutations and genetic drift, that in the virus, we know that that can happen. Has there been a substantial change? Uh, it's hard to say right now what, if any, minor changes have led to any presentation changes. But I think what we're really seeing is the spectrum of how the virus can present in different people. And because we as individuals vary in our own genetic, in our genes, you know, and our own coding, how we react to the virus coming to us will vary. And that's something that is a part of all of medicine. When people have even the same disease, say, how they present is going to vary. How we react to even medications will vary, which is exactly why we need different medication therapeutics with different actions, because how the virus is affecting us is also different. So we need different medicines too.
Yeah, there have to be a lot of different treatment options. There's not a one size fits all approach to treatment. Um, Also, in
Exactly.
terms of
That's really the theme of our
yeah,
talk is really like
yeah.
there is
You got it. Yeah, you have to sort of be able to roll with the punches at a time like this. But so early on, I think initially a lot of us there was sort of this intriguing, interesting idea here with this virus that it wasn't really getting children very sick. This was the people who were getting sick with COVID-19 were mostly adults. Not a lot of kids
yeah,
getting very
that's
sick. Yeah, but now we are seeing the kids, about 100 or so children nationwide with a Kawasaki-like syndrome that's related to coronavirus. So what is the link there?
well, so Kawasaki disease is something that has been known from the late 60s. It generally affects kids who are under 5 years of age, and it's really an inflammatory disease that can cause the rash, the fever, even respiratory symptoms or other symptoms. So what has been identified lately in certainly in New York and other states is that in this younger age group, uh, COVID can also act similarly in how Kawasaki disease presents
Hmm.
in children, and it is something that is now being brought to light and may explain actually why some kids have it. Now, what makes them more susceptible versus other kids? It's still a low number when you think about the likely general exposure that kids have had, just like any other family members. It's likely kids have been seen, but they're generally thought to have a mild presentation, if any presentation at all, which is the upside, but that the virus can affect some subpopulation of children and have this presentation of kind of a multi-organ inflammatory presentation with a rash and fever and other symptoms is something that we have to know. And again, this is kind of like we're flying the plane while we're building it too. We're in the midst of the pandemic and we're learning about what it does. I think this is very important that we're recognizing it, that we're looking at it, because this is yet another characteristic of the virus, and actually a characteristic that you do see from other viral illnesses or other diseases. And it's something that the scientific community has seen, of course, in Kawasaki and even other diseases, but it is about understanding what COVID is doing. So we're learning as we go. And still, the hope is that this doesn't affect, the vast majority of children. But what's really going to be important is to identify the cases, understand what the characteristics are, and understand if there is a group of kids or folks who may be more vulnerable or susceptible for any number of reasons. But it's all part of the scientific understanding of COVID-19.
Yep, learning as we go. That is that is the theme of this very challenging time that we're living in, for sure. We will leave the conversation right there. Really appreciate all of your insight, Dr. Vanila Singh, clinical professor at Stanford University School of Medicine and the former chief medical officer with the Department of Health and Human Services. Thanks so much, as always, for joining us. And I will let everyone know that we have more information that we have put up on our website. It is coronavirusnow.com. I'm Alex Savage from KTVU Fox 2 News in the San Francisco Bay Area, and we'll see you next time.